The fluorescent lights buzzed with that particular frequency that made Maya's molars ache as she counted her fourth breath, waiting for Dr. Harrison to acknowledge she was standing in his doorway. His silver Mont Blanc pen, the one she'd personally cleaned coffee stains from 3 times this month, scratched across what looked like budget reports. Each stroke deliberate enough to remind her that his time was worth more than hers. "Maya," he said without looking up, "close the door." She stepped inside the cramped office that served as the clinical director's command center for Riverside Community Health. The space reeked of industrial disinfectant and burnt coffee, two smells that had become as familiar as her own breathing over the past 4 years. On his desk sat a manila folder with her name typed on a label, never a good sign. "We need to discuss your patient advocacy incident." Maya kept her hands steady at her sides. She knew exactly which incident he meant. Last Thursday, when 8-year-old Marcus Williams had come in with his grandmother wheezing so badly he could barely speak. The boy needed a nebulizer treatment and possibly emergency care, but their insurance authorization was stuck in what Dr. Harrison liked to call processing delays. She'd made the call to override the delay. "I documented everything," as Maya said. "The boy was in respiratory distress. Waiting another day for authorization could have what?" Dr. Harrison finally looked up, his pale blue eyes sharp with the kind of administrative irritation that Maya had learned to read like weather patterns. "Could have saved this clinic from a $1,500 write-off." The fluorescent buzz seemed to grow louder. "Could have sent an 8-year-old to the emergency room," she replied. Dr. Harrison leaned back in his chair, which creaked like old leather, despite being made of cheap plastic. "Maya, you've been here 4 years. You understand how tight our margins are. Every unauthorized treatment puts us at risk." She did understand. More than he knew. Maya had spent her lunch breaks in the records room cross-referencing denied claims with patient outcomes. She'd noticed patterns that made her stomach twist. How authorization delays seemed to hit certain zip codes harder than others. How some families got expedited approvals, while others waited weeks for basic care. "What about our margin for keeping kids alive?" she asked. His pen stopped moving. "Excuse me." Marcus Williams wasn't the first child who came in with delayed authorization for emergency medication. There was Keisha Patterson in September, Antonio Valdez in October, Sarah Chen last month, all from families with Medicaid, all with delays that put them at risk. Dr. Harrison set his pen down with the precision of someone trying very hard not to lose his temper. "Maya, you're a medical assistant, not a policy analyst. Your job is to follow protocols, not question them." She felt something sharp and cold settle in her chest. For 4 years, she'd followed every protocol documented, every procedure, stayed late to catch up on paperwork without overtime pay. She'd covered weekend shifts when other staff called in sick, taken training courses on her own time, and never once complained about the broken air conditioning in the records room where she spent her lunch break studying patient files. But she had also kept meticulous notes. "Dr. Harrison," she said, reaching into her bag for a folder she'd hoped never to use, "I've been keeping records of authorization delays and patient outcomes. Would you like to see them?" His expression shifted from irritation to something colder. "What kind of records?" Maya opened the folder and placed a single sheet on his desk. It was a timeline, dates, patient names redacted for privacy, but authorization wait times clearly documented, alongside clinical notes about severity of symptoms. "Pattern analysis," she said. "Medicaid patients wait an average of 43 hours for emergency medication authorization. Private insurance patients wait an average of 6 hours for identical medications." Dr. Harrison glanced at the paper but didn't pick it up. "This is inappropriate, Maya. Patient confidentiality. Names are redacted. I followed HIPAA protocols." She placed a second sheet down. "This is a breakdown by insurance provider. And this," she added a third page, "is a comparison of emergency room visits among our pediatric patients, before and after authorization delays." The fluorescent buzz filled the silence. "Maya, you're overstepping significantly." "I'm doing my job. My job is patient care." "Your job is what I tell you it is." Dr. Harrison stood up, all 6 feet of administrative authority looming over her. "And right now I'm telling you that this conversation is over. You will not discuss patient care protocols with anyone outside this office. You will not continue an analysis. And you will certainly not imply that this clinic discriminates based on insurance coverage." Maya looked at him, really looked at him. In 4 years, she'd never seen Dr. Harrison lose his composure. He was the kind of administrator who spoke in measured tones and wore his professionalism like armor. But now she could see a muscle jumping in his jaw, could hear something defensive creeping into his voice. "I never said discriminate," she said quietly. "I just asked about the patterns." "There are no patterns. There are protocols and economic realities. This clinic serves a low-income community. We survive on razor-thin margins. Every unauthorized treatment threatens our ability to keep these doors open." Maya nodded slowly. "What about Marcus Williams' inhaler authorization?" "Eh, What about it? It came through yesterday, approved retroactively. The insurance company said it should have been expedited from the beginning. Respiratory distress in a minor is automatic approval." Dr. Harrison's face went very still. "The delay wasn't about authorization," Maya continued. "It was about processing. Someone flagged Marcus's file for additional review because his address matched a database of families behind on medical payments." "I don't know. How do you know that?" "I called the insurance company, asked them to walk me through the approval process. They were very helpful once I explained I was trying to improve our clinic's efficiency." The fluorescent light above Dr. Harrison's desk flickered, casting weird shadows across his face. "Maya, you are walking on very thin ice." She picked up her folder from his desk, leaving the 3 sheets behind. "Dr. Harrison, I've worked here for 4 years. I've never been written up, never missed a shift, never failed a quality review. I've helped implement 3 new patient care protocols and trained 6 new medical assistants. My patient satisfaction scores are consistently above clinic average." Your point, Tui, my point is that I'm good at my job. And part of being good at my job is noticing when systems don't work the way they're supposed to. Dr. Harrison sat back down heavily. "Maya, I'm going to be very clear with you. This clinic operates under strict oversight from the county health department and our insurance partners. We cannot afford to have staff members questioning established protocols or conducting unauthorized investigations into our operations." What if those operations are hurting children?" "They're not." "What if they are?" The silence stretched between them like a taut wire. Finally, Dr. Harrison opened the manila folder with Maya's name on it. "This is a formal written warning," he said, sliding a document across the desk. "You are being disciplined for overstepping your authority, violating patient confidentiality protocols, and insubordination." Maya looked at the paper. Her hands didn't shake as she read it, though she could feel her heartbeat in her throat. "I never violated confidentiality. All patient information was properly redacted. You accessed patient records without authorization for purposes outside your job description. I accessed records I personally helped create for patients I personally treated to identify patterns that could improve patient care. Sign the warning, Maya." She looked at him for a long moment. Dr. Harrison's face was set in administrative stone, but she could see something else in his eyes. Not quite fear, but definitely discomfort. "Can I take this home to review before signing?" "No. You sign it now or this becomes a termination meeting." Maya picked up his Mont Blanc pen, the one she'd cleaned so many times, and signed her name at the bottom of the warning. But as she wrote, she made a mental note of the date, the time, and the exact wording Dr. Harrison had used. She'd been keeping records for 4 years. She wasn't about to stop now. "Thank you," Dr. Harrison said, filing the warning away. "I trust this conversation will remain confidential." "Of course," Maya said. She walked back to her workstation feeling like she'd been holding her breath underwater. The clinical floor was busy, patients, checking in, nurses, calling back for appointments, the usual controlled chaos of a community health clinic. But everything felt different now. Every authorization delay she processed, every insurance call she made, every patient who waited longer than they should have, it all looked different through the lens of that conversation. Maya sat down at her computer and opened the patient scheduling system. Marcus Williams had a follow-up appointment scheduled for next week. His grandmother had called twice to make sure his inhaler prescription was ready. She pulled up Marcus's file and scrolled through his treatment history. The respiratory distress visit was documented along with Dr. Harrison's eventual authorization for the nebulizer treatment. But there was something else, a note she hadn't seen before, added yesterday after the insurance approval came through. Patient care provided exceeded protocol guidelines. Staff counseled on authorization procedures. Maya stared at the note. Dr. Harrison had added it to Marcus's file after their conversation. He was creating a paper trail that made her look like she'd acted recklessly, rather than documenting that she'd potentially saved a child from a trip to the emergency room. She opened a new document on her personal laptop, one she kept in her bag for lunch break research, and started typing. November 15th, formal warning issued following advocacy for patient Marcus Williams, 8-YO respiratory distress. Warning cited overstepping authority and confidentiality violations despite following all HIPAA protocols. Additional documentation added to patient file post-approval, suggesting staff error rather than systematic authorization delay. Her fingers moved quickly across the keys as she documented the exact sequence of events, Dr. Harrison's specific words, and the timeline of Marcus's treatment and insurance approval. Maya had learned something important in her 4 years at Riverside Community Health and Healthcare. Documentation was everything. Every medication dispensed, every treatment provided, every decision made, it all had to be recorded, justified, and traceable. But documentation was a two-way street. If Dr. Harrison wanted to create a paper trail that protected the clinic from criticism, Maya would create a paper trail that protected patients from harm. Over the next week, Maya noticed things she'd missed before, or maybe she was just looking harder now. It started with the phone calls. Every time a Medicaid patient needed authorization for medication or treatment, Maya was the one who made the call to the insurance company. She'd always assumed the delays were random. Some approvals came through in hours, others took days, depending on how busy the insurance office was. But now she started tracking the variables. Patient age, diagnosis, insurance type, home address, even which insurance representative she spoke with. She logged everything in a spreadsheet that lived on her personal laptop. The patterns became undeniable. Medicaid patients from 3 specific zip codes, the ones that included the city's 2 public housing complexes, waited an average of 52 hours for authorization. Medicaid patients from other areas waited an average of 18 hours. Private insurance patients, regardless of home address, waited an average of 4 hours. But the most disturbing pattern was the one Maya almost missed. On Thursday afternoon, she was processing authorizations for the next day's appointments when she noticed something odd about the insurance portal. When she logged in to submit authorization requests, the system seemed to route her to different queues depending on the patient's information. Maya called the insurance company directly. "Hi, this is Maya Williams from Riverside Community Health," she said to the customer service representative. "I'm trying to track an authorization request that's been pending for 2 days. Can you help me understand why some requests process faster than others?" "Sure," the representative said. "Can you give me the authorization number?" Maya provided the number for Marcus Williams' original request, the one that had taken 43 hours to approve. "Okay, I see this one. It was flagged for additional review because the requesting provider is on our enhanced screening list." Maya's pen froze above her notepad. Enhanced screening list. Some healthcare providers are flagged for additional review due to patterns of overutilization or billing irregularities. Requests from these providers automatically get routed to our investigation queue, which adds 24-48 hours to the approval process. Riverside Community Health is on this list. Yes, as of 6 months ago. Looks like it was added due to, let me see, high volume of emergency authorization requests and patient complaints about delayed care. Maya felt something cold settle in her stomach. Patient complaints about delayed care. That's what triggered the review. Patients were complaining that their medications and treatments were being delayed, so we investigated the provider's authorization patterns. The investigation found that the clinic was submitting emergency authorization requests at a rate significantly higher than comparable providers in the area. So you put them on a list that makes all their requests take longer. The enhanced screening process ensures that emergency designations are used appropriately and that patient care meets medical necessity requirements. Maya hung up the phone and stared at her notes. The insurance company had put Riverside Community Health on a slow processing list because patients complained about delays, and their solution to those delays was to create more delays. But that wasn't the worst part. The worst part was that Dr. Harrison had to know about this. Medical directors received notification when their clinic was added to enhanced screening lists. He'd known for 6 months that every authorization request was being delayed, and he'd never mentioned it to the staff who actually processed those requests. Maya looked around the clinical floor. Nurses and medical assistants hurried between patient rooms, making phone calls, processing paperwork, all of them wondering why insurance approvals seemed to be taking longer lately. None of them knew they were fighting a battle with one hand tied behind their backs. She opened her laptop and started typing again. November 22nd. Discovery that RCH has been on insurance companies' enhanced screening list for 6 months, adding 24-48 hours to all authorization requests. Medical director aware, but did not inform clinical staff of systematic delays affecting patient care. As she typed, Maya felt something shift inside her chest. This wasn't just about Marcus Williams' inhaler anymore. This was about a system that was failing dozens of patients every week and administrators who were more concerned with protecting themselves than fixing the problem. She thought about all the times she'd apologized to parents whose children were waiting for medication, all the times she'd explained that insurance approvals just took time sometimes, all the times she'd felt helpless watching families struggle with delays that she'd assumed were unavoidable. Maya closed her laptop and walked to Dr. Harrison's office. His door was open, and he was on the phone with what sounded like a billing issue. She waited until he hung up. "Dr. Harrison, can I ask you something?" He looked up with the expression of someone who really hoped this conversation would be brief. "What is it, Maya Key? How long have you known that we're on the insurance company's enhanced screening list?" Oi. The color drained from Dr. Harrison's face. "I don't know what you're referring to. The list that adds 2 days to every authorization request. The one we got put on because patients complained about delays in their care." Dr. Harrison stood up and closed his office door. "Maya, sit down." She remained standing. "You need to stop making phone calls to insurance companies," when he said. "You're stirring up issues that don't concern you. Patient care concerns me. That's literally my job. Your job is to process authorizations, not to investigate why they take the time they take." Maya looked at him carefully. Dr. Harrison was younger than she'd initially thought when she started working at the clinic, maybe 45, with prematurely gray hair that made him look distinguished in a way that probably helped with his administrative credibility. But right now he looked tired, more than tired. He looked trapped. "Dr. Harrison, if you know our requests are being delayed, why haven't you appealed the enhanced screening designation, or at least told the staff so we could adjust our processes?" He sat back down heavily. "Maya, you have no idea how complicated these things are." "Then explain it to me." "The enhanced screening designation isn't something you just appeal away. It's based on utilization patterns and patient complaints. To get removed from the list, we'd have to demonstrate sustained improvement in our approval processes and patient satisfaction metrics, which we could do if we knew what we were dealing with. Or we could trigger a full audit that shuts down this clinic permanently." Maya felt like she'd been punched in the chest. "What?" Dr. Harrison looked out his small window at the parking lot where a steady stream of patients was walking in for afternoon appointments. "Maya, this clinic serves 12,000 patients. Most of them have nowhere else to go. Medicaid doesn't pay enough to cover our costs, so we survive on a combination of federal grants, county funding, and private donations. We're audited every 6 months. Any irregularity in our billing or treatment protocols can result in funding cuts that would close us down. So you let children wait for medication rather than risk an audit. I make impossible choices every day to keep this place running." His voice was sharp with frustration. "Do you think I want kids to wait for inhalers? Do you think this is how I wanted to practice medicine?" Maya stared at him. For the first time since she'd started working at Riverside Community Health, Dr. Harrison sounded human rather than administrative. "What would happen if we appealed the enhanced screening designation? The insurance company would review our case. They'd look at our authorization patterns, our patient outcomes, our billing practices. If they found anything questionable, anything at all, they could recommend that other insurance providers put us on similar lists. We could go from serving 12,000 patients to serving 0 patients in a matter of months. And if we don't appeal, we keep doing what we're doing. Kids wait a little longer for medication, but they get it eventually. The clinic stays open and 12,000 people continue to have access to health care they wouldn't have anywhere else." Maya sat down. The fluorescent light above Dr. Harrison's desk had stopped flickering, but the buzz remained constant. "Dr. Harrison, what if there was a way to improve our approval processes without triggering an audit?" "Why no?" "What do you mean?" Maya opened her bag and pulled out her laptop. "I've been tracking authorization patterns for the past week. I think I've identified some variables that could help us predict which requests will be delayed and which ones will be approved quickly." She turned the screen toward him. "If we know that certain types of requests from certain patient populations are automatically flagged for enhanced screening, we can adjust how we submit those requests to minimize delays." Dr. Harrison looked at the spreadsheet Maya had created. His expression shifted from defensive to curious. "This is quite detailed. I've been working here for 4 years. I know which patients need what kinds of care, and I know how long each type of approval usually takes. But now I also know why some approvals take longer than others. She clicked to another tab in the spreadsheet. Look at this. Emergency medication requests submitted before 10 a.m. get processed faster than requests submitted after 2 p.m. Requests that include specific diagnostic codes get routed to different approval queues, and requests for patients with multiple chronic conditions get delayed longer than requests for patients with single acute issues. Dr. Harrison scrolled through her data. How did you figure all this out? I asked questions. I called the insurance company and asked them to explain their processes. I tracked which variables correlated with faster approvals and which ones correlated with delays. Maya, this is actually helpful. She felt something ease in her chest. I want to help. I want kids to get their medication faster. I just also want to understand why the system works the way it works so we can work with it instead of against it. Dr. Harrison was quiet for a long moment studying her data. If we implemented some of these strategies, submitting time-sensitive requests earlier in the day, using more specific diagnostic codes, bundling requests for patients with multiple needs, we could potentially cut authorization times in half without triggering any additional scrutiny. That's what I was thinking. Why didn't you just bring this to me instead of, he gestured vaguely, all the other stuff? Maya looked at him directly. Because when I tried to talk to you about authorization delays, you told me I was overstepping my authority and threatened my job. Dr. Harrison winced. Maya, I was trying to protect this clinic. I know, but you were also trying to protect yourself. What do you mean? You knew about the enhanced screening designation for 6 months. You knew it was making patients wait longer for care, and you knew it was because patients had complained about delays. Instead of working with your staff to fix the delays, you let us keep struggling with a system that was rigged against us, and then you disciplined us when we asked questions. The silence stretched between them. You're right, Dr. Harrison said finally. I should have told the staff about the screening designation. I should have worked with you to find solutions instead of just managing the problem. Maya nodded. Dr. Harrison, I don't want to create problems for this clinic. I want to make it better. But I need to be able to ask questions and share information without being afraid I'm going to lose my job. Fair enough. He looked at her laptop screen again. Can you put together a presentation about these approval patterns? Something I can share with the medical staff at our next meeting. Yes. And Maya, I'm going to remove that written warning from your file. You were right about the Marcus Williams situation. You probably saved him from an emergency room visit. Maya felt something tight in her chest finally relax. Thank you. Thank you. This is the kind of analysis that could really help our patients. As Maya walked back to her workstation, she felt like she was seeing Riverside Community Health clearly for the first time. The systems that had frustrated her for 4 years weren't just bureaucratic inefficiencies, they were the result of larger pressures and impossible choices that people like Dr. Harrison had to make every day. But that didn't mean the systems couldn't be improved. Over the next month, Maya worked with Dr. Harrison and the medical staff to implement new authorization protocols based on her research. They started submitting time-sensitive requests first thing in the morning, used more detailed diagnostic codes, and group-related requests together to reduce processing time. The results were dramatic. Average authorization times for Medicaid patients dropped from 43 hours to 18 hours. Patient satisfaction scores improved, and the clinic received fewer complaints about delayed care. But the most important result was something Maya noticed during her lunch breaks in the records room. When she reviewed patient files from the past month, she saw fewer notes about families making multiple phone calls, asking when their child's medication would be ready. Fewer emergency room visits from patients whose conditions had worsened while waiting for treatment. Fewer frustrated parents asking why their insurance was taking so long to approve medicine their child clearly needed. Maya was updating her spreadsheet with the latest authorization data when Dr. Harrison knocked on the doorframe of the records room. Honeycurry, Maya, do you have a minute? She looked up from her laptop. Of course. I just got off the phone with the county health department. They want to schedule a site visit to review our patient care improvements. Maya felt her stomach drop. Are we in trouble? Actually, no. They've been tracking our patient satisfaction metrics, and they want to understand how we've managed to improve our authorization processing times so dramatically in such a short period. Oh, they're particularly interested in your data analysis work. They want to know if your methodology could be applied to other community health clinics in the county system. Maya stared at him. They want to replicate this. They want to hire you as a consultant to help other clinics improve their authorization processes. I'm sorry, what? Amila. Dr. Harrison smiled, the first genuine smile Maya had seen from him since she'd started working at the clinic. Maya, you've identified systemic problems and developed practical solutions. That's exactly what the county health system needs more of. Maya looked down at her laptop screen where months of careful documentation and analysis were organized into neat spreadsheets and charts. I just wanted kids to get their medicine faster, she said. That's what makes you good at this. You never lost sight of why the work matters. 2 weeks later, Maya found herself in a conference room at the county health department, presenting her research to a room full of medical directors, nurses, and administrators from community health clinics across the county. The fluorescent lights in this conference room buzzed at a slightly different frequency than the ones at Riverside, but Maya had learned to tune out that particular sound. The key finding, she told the room, is that authorization delays aren't random. They follow predictable patterns based on patient demographics, insurance type, provider history, and even the time of day requests are submitted. Once we understand those patterns, we can adjust our processes to minimize delays without changing medical protocols. A medical director from the East Side Clinic raised her hand. How long did it take you to identify these patterns? About 6 months of systematic data collection, Maya said. But most of the improvement came from implementing changes based on what I learned in just the first month. And you did this while maintaining your regular job responsibilities. Yes, most of the data collection happened during lunch breaks and after hours. The room was quiet for a moment. Then the county health director, Dr. Martinez, leaned forward. Maya, your work has helped one clinic improve patient care and reduce authorization delays by more than 50%. But more importantly, you've developed a methodology that could help every clinic in our system provide better, faster care to the families who need it most. Maya felt something warm spread through her chest. Dr. Martinez, I just want to make sure kids get their medication when they need it. That's exactly why we need people like you working on these problems. Dr. Martinez looked around the room. Maya, we'd like to offer you a position as a patient care systems analyst. You'd work with clinics across the county to identify and address systematic barriers to patient care. Maya thought about Marcus Williams, whose inhaler authorization had started all of this. She thought about all the other children who came to community health clinics with their parents, trusting that the adults in the room would take care of them as quickly and efficiently as possible. She thought about Dr. Harrison, who'd been trying to balance impossible pressures while keeping his clinic running. She thought about the patterns she'd uncovered and all the patterns she probably hadn't found yet. Maya, when would I start? 3 months later, Maya was sitting in another fluorescent-lit conference room this time with medical directors from 12 community health clinics. Her laptop was open to a presentation titled Authorization Optimization, Systematic Approaches to Reducing Patient Care Delays. But instead of feeling nervous about presenting to administrators, Maya felt energized. Over the past 3 months, she'd worked with 8 clinics to implement modified authorization protocols. Patient satisfaction scores had improved across the board, and authorization times had dropped by an average of 42%. More importantly, Maya had started to see the bigger picture. Authorization delays weren't just bureaucratic inefficiencies, they were symptoms of a healthcare system that often worked against the people it was supposed to serve. But they were also solvable problems once you understood how the systems actually function. The key insight, Maya told the room, is that healthcare administration and patient care don't have to be in conflict with each other. When administrators understand how their decisions affect patients, and when clinical staff understand the pressures administrators are dealing with, we can find solutions that work for everyone. Dr. Harrison was in the audience representing Riverside Community Health. He'd become one of Maya's strongest supporters, and their clinic had become a model for other sites implementing authorization improvements. After the presentation, Maya was packing up her laptop when Dr. Martinez approached her. Maya, I have another project I'd like to discuss with you. What kind of project? The state health department has been tracking our county's improvement in community health clinic performance. They want to pilot your methodology statewide. Maya looked around the conference room where medical directors and administrators were networking and discussing implementation strategies. Dr. Martinez, 6 months ago, I was a medical assistant who got written up for asking too many questions. And now you're a systems analyst whose questions are improving healthcare for thousands of families. Maya smiled. When do we start? Later that evening, Maya was driving home from the county health department when her phone rang. The caller ID showed a number she didn't recognize. Hello. Is this Maya Williams? Yes, who's calling? This is Sandra Patterson. You probably don't remember me, but you helped my daughter Keisha get her asthma medication approved a few months ago. Maya remembered. Keisha Patterson had been one of the children whose authorization had been delayed, leading to a worsening of her condition and nearly requiring an emergency room visit. Of course I remember Keisha. How is she doing? She's doing great. Her medication comes through so much faster now, and she hasn't had any serious breathing episodes since October. Maya pulled into her apartment complex parking lot and put the car in park. I'm so glad to hear that Mrs. Patterson. Maya, I wanted to call because Keisha's teacher told me that you've been working with the county to help other kids get their medicine faster. Is that true? Yes, ma'am. I've been working with clinics across the county to improve authorization processes. Well, I just wanted to say thank you. I know you probably don't hear this much, but what you did for Keisha and what you're doing for other families, it matters more than you know. Maya felt tears prick at the corners of her eyes. Mrs. Patterson, that means everything to me. Keisha wants to be a nurse when she grows up. She says she wants to help kids like you helped her. After Sandra Patterson hung up, Maya sat in her car for a long moment, watching other residents come home from work, walk their dogs, carry groceries up to their apartments. 6 months ago, she'd been a medical assistant who'd gotten in trouble for asking questions about why children had to wait for medications they clearly needed. Now she was a systems analyst whose questions were changing how healthcare worked for families across the county and potentially across the state. But the most important thing hadn't changed at all. Maya Williams still wanted kids to get their medicine faster. She still wanted healthcare systems to work the way they were supposed to work. And she still believed that asking the right questions could make impossible problems solvable. Maya picked up her phone and opened the Notes app where she kept track of ideas for her next research project. Statewide authorization optimization, she typed. Research question, how can we reduce medication delays for pediatric patients across all insurance types and provider systems? She smiled and put her phone away. Some patterns were worth changing, and some questions were worth asking, no matter how much trouble they cause. Maya Williams had learned to trust her instincts about both.